Now, let's talk about the medication for hypertension. Although lifestyle changes can help lower blood pressure, people who already have hypertension need to take medication to control their blood pressure.
Sir, you should take a restorative. Something for your nerves. Your blood pressure is very high.
Do you hear that?
Blood pressure medications can help maintain blood pressure at healthy levels, thereby significantly reducing the risk of heart disease, stroke, kidney disease, and other conditions. There are many types of blood pressure medications, and here I will introduce the 5 main types. The first type is diuretics. As the name suggests, diuretics increase urine output. Since urine is primarily composed of water, this effectively removes excess fluid from the body, reducing blood volume and thereby lowering blood pressure. Diuretics are the first-line treatment for hypertension. Diuretics are generally not used alone, but are often combined with potassium-replenishing medications. This is because while diuretics promote urination, they also excrete potassium, which is an essential electrolyte in the human body. After exercise, we sweat, and sodium and potassium ions are also excreted from the body along with sweat. Therefore, we need to replenish electrolytes after exercise, especially after intense exercise such as marathon running, where athletes consume large amounts of electrolytes. During a marathon, athletes typically replenish electrolytes by drinking electrolyte-containing sports drinks. If you do not replenish the lost electrolytes after intense exercise, you may experience fatigue, dizziness, nausea, muscle cramps, or even irregular heartbeat. In fact, the amount of sodium and potassium lost through sweat is not significant, and most people do not engage in intense exercise frequently, so sweating is not excessive. However, if you use diuretics to frequently urinate, you will lose a significant amount of sodium and potassium through urine. Sodium can be obtained from salt and meals, but potassium is less readily available. Bananas and spinach are good sources of potassium, but not everyone eats them daily. Therefore, when taking diuretics, it is essential to replenish potassium. However, some diuretics already contain potassium, and these are called potassium-sparing diuretics. In such cases, additional potassium supplementation is not necessary. If potassium levels in the body are too high, this can also be problematic. Excess potassium in the body can lead to hyperkalemia, which can damage the heart's conduction system and cause arrhythmias. Diuretics are particularly suitable for the elderly, obese patients, and those with heart failure or kidney dysfunction. The second type is ACE inhibitors, which stand for angiotensin-converting enzyme inhibitors. Their blood pressure-lowering mechanism involves inhibiting the production of angiotensin II, thereby reducing blood pressure. These medications are highly suitable for patients with coronary heart disease, diabetes, young individuals, and those with chronic kidney diseases. The third type is angiotensin II receptor blockers, ARBs. The blood pressure-lowering mechanism of this drug is similar to that of angiotensin-converting enzyme inhibitors. This class of drugs directly blocks the action of angiotensin II to dilate small arteries. Its mechanism of action is more direct, so it has fewer adverse effects. The fourth type is calcium channel blockers. These medications work by blocking calcium channels on cell membranes, reducing the entry of calcium ions into heart and blood vessel smooth muscle cells. This dilates blood vessels, slows heart rate, and reduces cardiac workload, thereby lowering blood pressure. This medication is particularly suitable for young adults, the elderly, patients with angina pectoris, and those with migraines. The fifth type is adrenergic blockers, which include alpha blockers, beta blockers, alpha-beta blockers, and adrenergic blockers with peripheral activity. These drugs work by interfering with sympathetic nerve activity to slow heart rate and lower blood pressure. This type of medication is particularly suitable for young people, angina patients, and heart disease patients. However, it is not suitable for the elderly, as these medications carry a higher risk of side effects in this age group. The above are some of the main types of antihypertensive medications. Doctors typically prescribe 2 medications in combination to control blood pressure or select one medication for treatment. If the treatment is ineffective, they may switch to another medication. In principle, blood pressure medications require lifelong use. This is because hypertension is typically a chronic condition that cannot be completely cured. Therefore, long-term medication is necessary to control it. Most blood pressure medications do not cause side effects, but there are exceptions for certain special populations, such as pregnant women. Except for certain special populations, blood pressure medications only cause mild side effects, such as dizziness or headaches. Compared to the complications that can arise from untreated hypertension, such as heart, brain, or kidney issues, these side effects are negligible. Therefore, hypertension patients must never stop taking their medication on their own. You must strictly follow your doctor's instructions for medication and regularly monitor your blood pressure to ensure the medication is effective. If you experience significant side effects from a particular medication, you should promptly inform your doctor. The medications mentioned above are primarily for primary hypertension. If you have secondary hypertension, meaning your high blood pressure is caused by another condition, such as kidney disease, e.g., renal artery stenosis, you must first undergo surgery to address the underlying condition. This may normalize your blood pressure or reduce it, potentially eliminating the need for blood pressure medications. Therefore, for hypertension patients, it is essential to first visit a hospital to determine the type of hypertension you have. If it is diagnosed as secondary hypertension caused by another underlying condition, you must first treat the underlying disease or cause of the hypertension. This is the key to controlling blood pressure. Using antihypertensive medications alone is often ineffective for controlling secondary hypertension. Only targeted treatment of the underlying cause can achieve better results.